Think you got sciatica because your leg hurts? Let's actually break down what sciatica really is, how to know if you've got it, and how we might be able to help you treat it. So, sciatica itself is actually a symptom, not a cause, right? So sciatica basically means you have nerve pain from your sciatic nerve being squeezed somewhere in your body. Now, what is your sciatic nerve, right? Your sciatic nerve comes out of your lumbar spine, comes down your entire leg all the way down to your foot. And it's basically the main nerve that innervates, which is a word that basically means controls your leg, right? And gets the signals to move your leg and then gets the signals to come back, right? So your sciatic nerve is actually quite large. I've seen dissections of the entire lower leg before, and the sciatic nerve itself can be that big around, which is quite big. I'm gonna go ahead and read the definition of the sciatic nerve from KenHub, which is like an anatomy website that helps teach anatomy. And I'm basically just doing this to make sure that the clarity of the anatomy is super clear, right? So it comes out of the lumbar spine, so L4, L5, but also the upper part of the sacrum. So S1, S2, S3. So, and I'll explain what those L's and those S's mean in a second. But basically the nerve roots come out of those different vertebrae, come together and form the really thick sciatic nerve, and that travels down through your hip, all the way down the leg, and all the way down to the foot. It does branch off at certain parts of the leg into different nerves. But when you hear the term sciatica, what you're really thinking is that the sciatic nerve at one of those nerve roots at the L4 through S1 places has been pinched in some way, and it is causing irritation to the nerve, which is causing pain symptoms, but also sometimes tingling or numbness or achiness, either into the hip or down the leg itself, all the way down to the foot sometimes. Okay, so what do all those different terms mean? So let's get clear about L and S. So when we're talking about the spine, we have four regions that the spine has. There's the C region, the cervical region up here in the neck, and you have C1 through 7 on almost most humans. I have actually met a couple of rare cases where somebody has a C8, but that's super duper duper rare. Then you have the T region, the thoracic region, which is T1 through 12, which is here through here, where all of the rib cage comes out of those vertebrae and forms the rib cage. And then you have the low back or lumbar region, which is L1 through 5. And again, most people have only 5, but there are rare cases of slightly rare, but not as rare, of partially formed L6s. I actually have a really good friend of mine, Karen, who has a partial L6, which isn't very fun. And then I've actually met one very, very rare case of a fully formed L6. But in most cases, most people have 5. And then below that, you have the sacrum. When you hear about your SI joint, your sacroiliac joint, they're talking about the sacrum. And that has anywhere from 3 to 5 vertebrae that are fused together into this one block of bone. And it is slightly different on different people. It can be anywhere from 3 to 5. And each of those places has nerves that branch off of the vertebra. And so you can think of the sciatic nerve as starting at L4, and going down to S3, and each of those has a branch that comes together and fuses into one big bundle called the sciatic nerve. And then that comes down through the hip and down through the leg. So we'll get a little clearer on that. But from a doctor's perspective, when they're talking about true sciatica, they're talking about an impingement of that nerve in one of those places or more at the spinal level. Now that can be a number of different sources. That could be from a car accident that crushes vertebra. And I have a client from years ago that had all 5 lumbar vertebrae crushed and then fused together into one giant vertebra that irritated the heck out of his sciatic nerve from time to time. That could be caused by scoliosis, where you have a curvature sideways of the spine that's going to squeeze the spine from side to side, that may squeeze the nerve root on one side or the other. That might irritate the nerve on one side or the other and cause some of those symptoms: numbness, tingling, pain, achiness. You could also have a lot of compression posteriorly towards the back of the body or anteriorly towards the front that could squeeze those nerves in different ways. You could also have pressure that pushes the discs of the vertebra that are the cushions between the vertebra in such a way that the disc bulges and presses on the sciatic nerve and causes sciatica. So from a doctor perspective, when they term sciatica, they're talking about some sort of irritation of the sciatic nerve at the spinal level. However, it is more broadly used to term the symptoms that causes: hip, leg, numbness, tingling, pain, and can refer to impingement of the sciatic nerve in multiple places. So let's make some distinctions. I should just show here. I hope that this can show up on camera. Let's see. So here we have an image. This is what I was talking about with the nerve roots coming out of L4 through S3, right? And so here would be the bundles of nerves coming out of the different vertebra, and you can see it on this side. And then those form one big nerve called the sciatic nerve here, right? So when I said that you have irritation of these nerves here, up there, that's where you would have the spinal level sciatica. You can also have something called Piriformis syndrome, which is essentially a different version. So here, in this, you can see how the sciatic nerve actually comes right between some muscles in your hip. And so let's define what those are. We've got the lateral rotators of the hip. And by the way, this book, I should give some credit here. This is a book called The Trail Guide to the Body. It was one of our main textbooks in massage school. It's a really great book that is complex enough for a decent practitioner to have and learn from, but simple enough that most people would get something out of it if you have any interest in learning anatomy. If you don't, then it's a lot to digest. But if you really want to learn the muscles and how the basics of musculoskeletal anatomy, this is a really good place to start. And this is my copy from 2007, by the way. Okay. So here we have the lateral rotators of the hip. What does that mean? Lateral means to the side. Rotation means obviously what it sounds like, and the hip is your hip. And so you've got this set of what we would call the deep 6 rotators, and you'll see a few of them right here. So there's piriformis, gemellus superior, gemellus inferior, quadratus femoris, obturatus internus, right? So those are the 5 of the 6. And then technically you would also have gluteus minimus in there as well. So what you can see here is how the sciatic nerve basically runs right behind the piriformis muscle and right above the obturator internus muscle. And that space right there has the potential for those 2 muscles, if they get really tight, to squeeze the sciatic nerve and cause sciatica symptoms. So you may hear the term piriformis syndrome. That is basically a form of sciatica where the piriformis is considered so hypertonic, which basically is a fancy word for super tight, that it is squeezing the sciatic nerve right here where it comes out. And that is pinching the nerve when you're sitting too long, let's say, or in certain movements. In general, you'll see this on people that stand with their feet really out like this or out like this on one side, and that's the side that has the symptoms. If you drive really long, that foot that's on the accelerator will often then tighten the piriformis. If you imagine that this is your foot and this is your hip, this will get really tight, and then you'll start getting sciatica symptoms down the right leg from driving long periods of time, but it also happens to show up in people who sit a lot as well. So that's one major place that the sciatic nerve can get compressed and impacted, and then you get the symptoms of sciatica. So again, we covered the idea that this is a symptom, not a diagnosis, and not a cause, right? Like, this is what is happening from a pain perspective, but the root cause could be any number of things. Your pain itself may show up in your back, it may show up in your hip, it may show up in your hamstring or your calf, or even all the way down to your foot. Piriformis syndrome can be a very common cause, but also a herniated disc in your lumbar region can cause it. Postural patterns and poor posture can certainly be a source of this that leads to it over time. Scoliosis can be a very common cause for this. And when you have scoliosis as a cause, it is something that will come back over and over and over, and you're gonna need to learn ways of managing it so that you can prevent it from coming back as often, and then when it does come back, get it to tamp down much more quickly. Oh, and one other instance before I forget, there is a thing that I like to call pregnancy sciatica, which is that somewhere usually in the second trimester, sometimes early third trimester, the weight of the baby has shifted your balance and your center of gravity such that you naturally start to externally rotate your feet for balance, which causes you to tighten those deep six rotators in your hip, tighten your piriformis muscle, squeeze your sciatic nerve. And so it's also, thankfully, one thing that massage therapy and the kind of work we do at Bodywork can help a lot with. A, getting those deep six rotators to loosen up a little bit and getting those feet to come back towards the front, and the stance from out here to more narrow can relieve a lot of pressure on the sciatic nerve and get those symptoms to calm down and go away. Working on ankle mobility can make a big difference because often the hip will tighten up in response to an old ankle sprain, and the lack of mobility there will cause the hip to overwork and the lumbar region to overwork. And so even if you've had a bunch of work on your hip and back and you don't seem to get much relief from that, often working down on the lower leg can actually be the unlock that makes that finally get relief and go away. And certainly working on psoas, iliacus, deep hip flexors, diaphragm, abs, and those sorts of things, even the entire hip wheel, getting that to move much better in the socket, that will generally provide a lot of relief for these symptoms. I can tell this story about this client I had years ago, at this point maybe even 10 years ago, who had the most advanced version of sciatica I've ever encountered. So this client was a vet who had been in Iraq. He had been literally trucking around Fallujah with 110 pounds of gear on his back in combat boots for a few years, and blown out a couple different discs in his lumbar, and I mean ruptured and really destroyed them, and needed multiple surgeries, and had gotten to the point where his right leg was completely numb. The surgeries helped short term for about a year or two. And then he got a job at Goldman Sachs and was staring at monitors, sitting for 14 to 16 hours a day, 6 days a week. And his symptoms flared up like you wouldn't believe. And he was literally in agony. His whole leg was just numb or in pain, and only those two things. And we were able to get him in 3 to 5 sessions to 90% relief. We did find that every day when he, every Monday when he went back to the office, those symptoms would ramp back up. And then by the time he got out of there and was able to take a break, they would calm down. We gave him enough tools that he was able to mostly be in control of that. But we also did learn that like he needed to get a standing desk, he needed to be able to move more and stretch more throughout the day. And that, you know, he still had ups and downs with it. But we basically took him from agony to total numbness to potentially needing, you know, another surgery to 90+% relief with a lot more control over his life and the tools that he needed to manage it, such that, yeah, he had to come in every once in a while for some tune-ups to help continue to manage it, but basically knew what he needed to do to keep it under control, and that he was able to prevent it most of the time. So it's a very manageable symptom for most people. I won't say that every single person it's solvable for, but for the vast majority of people, it's something that is very easily dealt with a series of, let's say, 3 at the very minimum to usually more like 5 to 8 sessions with us. And they won't all just be right on that area. It's going to be a lot of work. It's going to be some work there, some work on the knee, some work on the ankle, definitely, but also maybe even some work on the shoulder and neck to realign those to take pressure off of the low back. But it's definitely something that we've dealt with a lot and we can do a lot for. So if you're in New York City and you are dealing with any of these sciatica type symptoms, whatever the cause, whether it's driving or walking or sitting all day, or you're in your second trimester and you suddenly get onset sciatica, book a session. We definitely can help you. We can definitely create a plan that will help you long term. We can give you some homework and some tools that will help you lock in the results that you get such that you can manage it long term. And it's a highly solvable problem. So if that sounds like a good idea, we'd love to work with you, and have a great day.